The first proclamation this morning is going to be presented by myself and Supervisor Ron Roberts to a longtime friend of both of us, but more importantly, just a tremendous individual that has made such a significant difference in this region over the years. Dr. Brent Eastman is an individual that has been with Scripps for a long time, but more important than that, he is truly the father of our trauma care system for the San Diego County region, and a tremendous trauma care system it is. I think it's nationally recognized as the best in the United States. And we wanted to invite Dr. Eastman to come up this morning to receive a proclamation. I know with Dr. Eastman is his wife, Sarita Eastman, who is also a medical doctor, if you want to come up too. And we have a couple of other individuals, Dr. Bruce Haynes and Gail Cooper, who is the former director of the county's trauma care system. And then finally, Michael Barden, who is the senior director of Public Government Affairs Office of the President at Scripps Health. So we got quite a crowd to be with you here today, Brent. Brent Eastman, MD, attended college at the University of Wyoming and received his medical degree from the University of San Francisco in 1966, realizing the goal from his early youth to become a doctor, to serve, and to save others. Dr. Eastman immediately distinguished himself as a leader in vascular and trauma surgery, becoming a fellow in the American College of Surgeons in 1976 and the Paul Whittier Endowed Chair of Trauma at Scripps Memorial Hospital. In 1984, with his trauma physician colleagues in San Diego, Dr. Eastman designed and received the approval of the San Diego County Board of Supervisors for a new model of trauma care, dramatically reducing preventable trauma death from the program's inception and continuing today, thereby highlighting the San Diego worldwide as a model of trauma care. Based on his continuing work with the ACS communities on trauma, Dr. Eastman has personally helped develop trauma systems throughout the United States, England, Australia, Brazil, Argentina, Canada, Mexico, South Africa, India, and Pakistan. I was talking with him earlier. I think he's been to most of those areas in the last couple of weeks, right? Maybe months. For over a decade, Dr. Eastman has served in the top doctor role of Chief Medical Officer and Corporate Senior Vice President of Scripps Health, leading the efforts of the 2,600 affiliated physicians of Scripps Health in the pursuit and practice of the highest quality health care to the residents of the San Diego region. And now Supervisor Roberts will go ahead and finish up the proclamation.
We have literally had people in from all over the world to see how this is done. This Board of Supervisors was very fortunate in inheriting this model. It was here in place, and we can only be thankful for the supervisors that came before us that were wise enough to take the advice of Dr. Eastman and probably a few others. But Brent Eastman has literally been the driving force for all of these years, probably the one continuum from the start of the system to its current day. We're very proud of this. And for those of you who are wondering, a trauma system is something that we hope you don't need, but it's really a designation that we have on 5 hospitals here in San Diego. So they are ready 7/24 around the clock should you have any kind of a serious accident and have to be taken where you're going to need more than just somebody to look at you and give you a couple of aspirins, where you're going to need serious, immediate medical attention. It's helped save countless lives. It's helped so many people, and it's made us a better health system. For that, Dr. Eastman, we thank you. I'll finish the proclamation here. It recognizes so many things that he's done. Greg just mentioned all of the different countries he's visited. He has also participated in the American College of Surgeons, the American Association for the Surgery of Trauma, Distinguished Visiting Surgeon in the Combat Casualty Program at the Lundstall Regional Medical Center in Germany, and he received the distinction of honorary member of the U.S. Army Medical Department Regiment by the Order of the Surgeon General, and honorary order of the Military Medical Merit by the Order of the President. In 2010, Dr. Eastman co-led with Scripps President Chris Van Gorder the Scripps Medical Response Team to aid the victims of the devastating earthquake in Haiti. and his many leadership roles within the American College of Surgeons culminated in his election as the 93rd president of the American College of Surgeons, a post that has placed him in an international role for the education and advancement of surgical medicine in the coming era of healthcare reform. This is why he's kind of leaving us now. And as you know, we are going to miss his counsel. I can share that with you. Dr. Eastman, I am honored to be here today to present to you a proclamation that declares this to be Dr. A. Brent Eastman Day throughout the San Diego County. Best wishes to you.
Wow. I would like to say just a couple of words. First of all, thank you for the recognition that I should share with many, several of whom are here today in San Diego, who created the San Diego Trauma System, as you've heard, almost 30 years ago. We'll celebrate our 30th anniversary next year. First of all, I too would like to recognize the San Diego County Board of Supervisors, who I would say had the courage and had the vision to do something really remarkable in 1984 and regionalize trauma care and create a trauma system. I remember well the day I came up here, one of several surgeons, along with Dr. Virgilio and Dr. Shackford and many others, and watched expectantly to see if we had 3 votes that would mean the birth of the San Diego Trauma System. And I believe we had 5, and hence it was born. Others, like Gail Cooper, who is here, was then Chief of Emergency Medical Services, and today Bruce Haynes, have really directed the operational side of the San Diego Trauma System. And if you remember nothing else that I say, this is an example of a public-private partnership that I don't believe has been equaled, and it has become unequivocally a worldwide model. It has, as you've heard, resulted in lives being saved, and in fact, we know statistically that the preventable death rate in 1983, before the San Diego Trauma System was born, we had a 22% preventable death rate. That meant people came to all of our hospitals, good hospitals, but died for lack of a system, immediate care. The trauma system was inaugurated in 1984. In the subsequent year and ever since, thanks to people like Gail and Bruce and the people who run the trauma centers in this county, it is now down to 1 to 2% and has never exceeded that. I would suspect that many of you in this audience know somebody or know somebody who knows somebody whose life has been saved by this trauma system. Finally, I would say that ours is a remarkable example of a collaboration between 5 healthcare systems, between UCSD, Sharp, Palomar, Rady Children's, Scripps Memorial La Jolla, and Scripps Mercy. Scripps Health, where, as you've heard, I've had the privilege of spending my entire clinical life. And I can tell you that my position in the American College of Surgeons today is really based on what I have been able to learn and profit from the San Diego County Trauma System. So on behalf of all the patients, all the citizens of San Diego, I would like to thank the San Diego County Board of Supervisors for having the courage in 1984 and continuing to have the courage to support our San Diego Trauma System. Thank you very much for this honor today.